Cardiac surgeon warns. This drug is damaging the hearts of older adults. Imagine waking up every day with a strong heart, full of energy to play with the grandchildren, walk the dog, or simply enjoy retirement without constant fear. But what if the medicine that millions of older adults in the United States take every day, prescribed to protect the heart or control pain, is actually quietly damaging their heart muscle, gradually weakening it? I am Dr. Natisha, a cardiac surgeon with over 20 years of experience saving lives in the operating rooms here in the United States. Today I reveal the shocking truth I see daily in my patients. A common medication is causing irreparable damage to the hearts of older adults. Watch until the end of this video and find out how to protect your heart, avoid serious complications, and gain years of healthier and fuller life. Feel free to write your city in the comments below. It's always a great pleasure to hear from people across the country who are watching and caring about their heart health. If you like this type of direct alert that can save lives, give it a like now and subscribe to the channel by activating the Tinkerbell, so you'll never miss out on exclusive content like this one, which delivers vital information to protect you and your family before it's too late. Your health is worth these 35 minutes. Let's get started. Let's get right to the point. The drug I'm warning you about today is ibuprofen. Yes, that same anti-inflammatory you find in any over-the-counter pharmacy, sold as Advil, Motrin, or generics. Millions of older adults in the United States take ibuprofen every day, often for years on end, to relieve joint pain, arthritis, back pain, headaches, or even to control chronic inflammation. Doctors used to prescribe it quietly because it's effective against pain and inflammation, and for decades it was considered relatively safe compared to other, stronger painkillers. But science has evolved, and the data we have today, especially from large studies published in the last 10 years, show a very different picture. Ibuprofen belongs to the class of NSAIDs, non-steroidal anti-inflammatory drugs. These drugs work by blocking enzymes called COX-1 and COX-2, which produce prostaglandins responsible for inflammation and pain. The problem is that these same prostaglandins also protect the heart and kidneys. When you block this protection for a long time, especially after the age of 65, the heart begins to suffer. Studies show that chronic use of ibuprofen significantly increases the risk of heart failure, myocardial infarction, and even cardiovascular death in older adults. A large study published in the European Heart Journal followed more than 8 million people, and concluded that regular use of ibuprofen was associated with an increase of up to 50% in the risk of hospitalization for heart failure in patients over 70. Another study by the American Heart Association pointed out that among the elderly who take NSAIDs daily, the risk of developing resistant high blood pressure and fluid retention, two classic triggers for the overloaded heart, rises alarmingly. And the most worrying thing, these damages are silent. Many patients do not feel anything at first. The heart gradually weakens, the arteries become stiffer, the heart muscle loses efficiency. When symptoms appear, shortness of breath when climbing stairs, swelling in the legs, extreme fatigue, often the damage is already significant. I see this in the operating room often. Patients who have taken ibuprofen for years to control arthritis, and end up needing bypass or heart valve replacement. I'm not saying that an occasional dose for acute pain is dangerous. The problem is daily, prolonged use without proper supervision, exactly the pattern we see in many older Americans who want to stay active and independent. So why do so many doctors still prescribe or allow patients to continue taking it? Because chronic pain is real, because alternatives can be more expensive or difficult to tolerate, and because, for a long time, cardiovascular risks were not as widely publicized. But now the evidence is clear and undeniable. And if you're thinking, but I've been taking this for years and I feel fine, know that many of my patients also felt fine, until they didn't feel it anymore. In the next chapter, we'll dive into the scientific evidence and the exact mechanisms of how this drug damages the heart, so you understand exactly what's going on inside your body. Now that you understand the problem, let's get to the irrefutable facts. As a cardiac surgeon, I don't speak for opinion. I speak based on decades of studies published in journals like The Lancet, JAMA, and by the American Heart Association. The main mechanism is clear. Ibuprofen inhibits the enzymes COX-1 and COX-2 non-selectively. These enzymes produce prostaglandins that regulate inflammation, but also protect the heart. Specifically, inhibition of COX-2 reduces prostacyclin, a substance that dilates blood vessels, prevents platelet aggregation, and maintains cardiovascular balance. At the same time, inhibition of COX-1 affects thromboxane, but the general imbalance favors the formation of clots and increases blood pressure. Studies show that this leads to real effects: fluid retention, elevated blood pressure, and overload on the heart, especially dangerous in the elderly, whose cardiovascular system is already more vulnerable. A Bayesian meta-analysis of individual patient data, published in the BMJ in 2017, analyzed millions of cases and concluded that the use of ibuprofen even for a week increases the risk of acute myocardial infarction by about 48% at common doses. The probability of high risk was 97% for ibuprofen. Higher doses and prolonged use make this worse. The FDA here in the United States has reinforced the warning in 2015. All non-aspirin NSAIDs, including ibuprofen, cause increased risk of heart attack and stroke, which can be fatal. They point out that the risk grows with duration of use and is higher in patients with a heart history or the elderly. Specific studies in the elderly show even more alarming risks. A large cohort study in the elderly population associated chronic use of ibuprofen with up to a 50% increase in the risk of hospitalization for heart failure. Another analysis in patients over 70 revealed that NSAIDs like ibuprofen exacerbate sodium and fluid retention, leading to cardiac decompensation. Something I often see in practice: patients arriving with severe swelling, shortness of breath, and the need for surgical intervention. In my career of more than 20 years, I have operated on countless patients who used ibuprofen daily for arthritis or chronic pain. Many felt good for years, but the heart quietly weakened. When infarction or insufficiency comes, the damage is already extensive. Stiffer arteries, dilated heart muscle, impaired valves. It's not conspiracy theory. It's established science. The pharmaceutical industry recognizes the risks, but ibuprofen continues to be sold freely because chronic pain is common. But you deserve to know the full truth. And it doesn't stop there. In the next chapter, let's see how these risks play out in real stories of American patients. People like you or your loved ones, who have suffered serious consequences. Now let's go beyond the numbers and the studies. Let's talk about real people, patients I met, whose lives were changed because of the ibuprofen they took every day. I met Mrs. Eleanor, 72, from Ohio. She was active, walked in the park with her grandchildren, took ibuprofen daily for more than 10 years for arthritis in her hands and knees. "It's just a little pain," she said. One day, she woke up with shortness of breath so bad that she could barely speak. At the hospital, we discovered advanced heart failure. The heart was dilated, the valves weakened. She needed intense diuretics, repeated hospitalizations, and, unfortunately, lost the independence she valued so much. When I asked about ibuprofen, she was surprised. My doctor never mentioned that it could affect the heart. Another case that marked me was Mr. Roberts, 68, of Texas. Veteran, strong, took ibuprofen for back pain after years working in construction. He felt invincible, until he suffered a silent infarction of those that do not give the classic chest tightness, but destroy the muscle little by little. When we operated on him, we saw hardened arteries and already dead areas of the heart. He confessed to me, "I took it 2 or 3 times a day because the pain would come back if I stopped." Today he struggles to regain his strength, and the family lives in constant fear. And these are not isolated cases. I see this on a weekly basis. Elderly people who arrive at the emergency room with leg swelling, uncontrolled high blood pressure, severe arrhythmias, all with a history of long-term use of ibuprofen or other NSAIDs. Many think, if I stop taking it, the pain comes back and my life stops. But the truth is that chronic pain is challenging, yes, but heart damage can be irreversible. These stories are not to scare. They are to warn. Because each of these patients could have avoided the worst if they had known about the risks earlier. They were people like you. Grandparents, parents, husbands, wives who just wanted to continue living fully. The impact goes beyond the body. It is the loss of independence, the fear in the eyes of the children, the cancelled vacations, the postponed plans. But there is hope. And it starts with information. The good news is that you don't have to live with chronic pain or risk your heart. There are safe and effective alternatives to replace ibuprofen, and many of them are more powerful than you might think when combined correctly. I see patients transform their health every day by making these changes. First, talk openly with your doctor. Take this video or write down the main points. Mention the cardiovascular risks documented by the FDA and the American Heart Association. Ask for a complete evaluation of your heart, an echocardiogram, blood test for kidney and heart function, and accurate blood pressure measurement. Many doctors are up to date on these alerts and can adjust their treatment plan immediately. For pain and inflammation control without NSAIDs, here are the safest and most proven options that I recommend to my elderly patients. 1-acetaminophen, Tylenol, in moderate doses, up to 3,000 milligrams per day divided, is the first line for mild to moderate pain. It does not have the same cardiovascular impact as ibuprofen. Monitor the liver if using for long-term. 2. Topical therapies. Creams or gels with topical diclofenac, Voltaren gel, or capsaicin. They act locally, with minimal absorption into the blood, dramatically reducing the risk to the heart. Thousands of seniors in the United States use it daily for arthritis in the hands, knees and back. 3. Supplements with solid evidence. 1. Omega-3 from fish oil or algae. 2 to 4 grams per day reduce systemic inflammation and protect the heart. Studies by the American Heart Association show real benefits. 2. Turmeric, curcumin, with piperine for better absorption. 1,000 to 2,000 milligrams daily help with arthritis and inflammation without affecting the heart. 3. Coenzyme Q10, 100 to 200 milligrams per day, especially useful if you take statins, as it helps restore energy in heart cells. 4. Lifestyle changes that really work. 1. Low-impact exercises. Brisk walking 30 minutes a day, swimming, yoga or tai chi. These movements release natural endorphins, reduce inflammation and strengthen the heart. 2. Anti-inflammatory diet. Prioritize fruits, vegetables, nuts, fatty fish, olive oil, and avoid refined sugars and processed foods. The Mediterranean diet has been proven to decrease inflammatory markers by up to 30%. 3. Physical therapy and acupuncture. Many insurers cover sessions that relieve chronic pain without medication. 5. Complementary techniques. Alternating hot/cold compresses, therapeutic massage and mindfulness to reduce pain perception. Patients who adopt these strategies report less pain, more energy, and most importantly, healthier hearts. A follow-up study of elderly people who switched NSAIDs for these alternatives showed a 50% reduction in the risk of cardiovascular events over 5 years. Start small. Choose a change this week, perhaps swap ibuprofen for acetaminophen and add a daily walk. Monitor how you feel. Your body will thank you. We have reached the decisive moment. You've seen the real risks of ibuprofen, the irrefutable scientific evidence, the stories of patients who could have avoided suffering, and the safe alternatives that work. Now it's up to you. Do not wait until pain or shortness of breath forces your hand. The best time to protect your heart is this very moment. Today, December 26, 2025. Here's what you should do right away. First, make an appointment with your family doctor or cardiologist later this week. Take a simple list. I am concerned about the cardiovascular risks of ibuprofen documented by the FDA and the American Heart Association. Can we discuss alternatives such as acetaminophen, topical gels, omega-3s and lifestyle changes? Be direct. Doctors respect informed patients. Second, start with a small change today. Change your next ibuprofen tablet to acetaminophen, respecting the maximum dose of 3,000 milligrams per day. At a 20 to 30 minute walk. Even if it's slowly around the block, your body begins to respond within a few days. Third, download my free guide, Protect Your Heart, Safe Alternatives to Ibuprofen. The link is in the description and pinned comments. There you can find checklists, simple anti-inflammatory recipes, and a 7-day plan to get started without overload. And please share this video with someone you love. A father, a mother, a brother, a friend who takes ibuprofen daily. A simple share can save a life. Many of my patients tell me that they only discovered these risks because someone showed them a video like this. If this alert made sense to you, support the channel now. Like, subscribe and activate Tinkerbell. This ensures that direct, evidence-based content like this gets to you before it's too late. Each like and subscribe helps reach more people who need this notice. You are not alone in this journey. Millions of Americans are waking up to this reality and choosing to live healthier. You deserve decades of energy, independence, and happy times with the one you love, without the silent risk of an ordinary drug. Your heart is the engine of your life. Take care of him as he deserves. Now, we have reached the end of these 35 minutes that can change the course of your health forever. Let's recap what we saw together. Ibuprofen, a drug that millions of older adults in the United States take daily to relieve joint pain, arthritis, or chronic inflammation, is not as harmless as it seemed for decades. The science is clear. Prolonged use significantly increases the risk of heart attack, heart failure, uncontrolled high blood pressure, and silent damage to the heart muscle. Studies by the American Heart Association, meta-analyses in the BMJ and FDA alerts confirm this. Especially dangerous after the age of 65. I, as a cardiac surgeon with more than 20 years on the front lines of operating rooms, saw the price it takes. Patients who arrive strong and independent, but with weakened hearts, needing complex surgeries or facing limitations they never imagined. Stories like Mrs. Eleanor's and Mr. Roberts are no exceptions. They are the pattern we see over and over again. But most importantly, you have the power to change that. Safe alternatives exist and work. Acetaminophen in controlled doses, topical gels, supplements such as omega-3 and curcumin, anti-inflammatory diet, light exercise, and physiotherapy. When my patients adopt these changes, they not only reduce cardiovascular risk by up to 50%, they regain energy, independence, and joie de vivre. Remember, your heart is not just an organ. It is the engine that allows you to hug your grandchildren, walk along the beach at sunset, dance with those you love, and plan the coming years with peace of mind. Every ibuprofen pill you avoid, every walk you take, every honest conversation with your doctor is an act of self-love and caring for those who depend on you. I swear, as a doctor who has dedicated her life to saving hearts, knowledge saves lives. You now have that knowledge. Don't keep it to yourself. Share this video, make that appointment, start a small change today. The future of your health is in your hands, and it can be bright, long, and full of precious moments. Thank you for spending these 35 minutes with me. It was an honor to warn and guide you. Take care of your heart. It takes care of everything else. If this video has touched you, give it a final like, subscribe to the channel, and activate the Tinkerbell so as not to miss more alerts and tips that protect your health. Write in the comments, "I will act today." Let's create a community of people who choose to live longer and better. You deserve it. Your heart deserves it. Start now.